administration to continue pursuing meaningful reforms that serve the American people more effectively and more efficiently. Too often, patients encounter a healthcare system that is disjointed and is a dysfunctional maze. Complex and bureaucratic chutes and ladders have become the norm. Meanwhile, even as healthcare spending climbs, outcomes across a range of conditions continue to decline. Mr. Kennedy, if confirmed, you will have the opportunity to chart a new and better course for the federal approach to tackling both the drivers and the consequences of our ailing healthcare system. Your commitment to combating chronic conditions that drive healthcare costs will be critical to our success. Prioritizing disease prevention and addressing the factors that fuel conditions such as diabetes, cardiovascular disease, metabolic disease, Alzheimer's disease, COPD, and cancer will save lives, reduce costs, and build a healthier, stronger country. Private sector breakthroughs from groundbreaking cancer medications to curative gene therapies also offer hope. But misguided government initiatives and market volatility risk eroding American leadership in life-saving R&D. Your advocacy for healthcare transparency has the potential to empower consumers across the country, promoting competition to enhance quality while cutting excessive spending for patients and for taxpayers. Today's hearing will provide a forum to hear more about your vision, particularly for the federal programs under this committee's jurisdiction. Mr. Kennedy, you represent a voice for an inspiring coalition of Americans who are deeply committed to improving the health and well-being of our nation. Regardless of political party, everyone in this room shares a common recognition that our current system has fallen short, as well as a common desire to make our country healthier. I look forward to today's conversation as well as your testimony, Mr. Kennedy. And now I recognize Senator Wyden for his opening remarks.
Thank you very much, Mr. Chairman. The question before the Finance Committee this morning is whether Robert F. Kennedy should be trusted with the health and well-being of the American people. Committee staff have examined thousands of pages of statements, books, and podcast transcripts in a review of his record. The receipts show that Mr. Kennedy has embraced conspiracy theories, quacks, charlatans, especially when it comes to the safety and efficacy of vaccines. He has made it his life's work to sow doubt and discourage parents from getting their kids life-saving vaccines. It has been lucrative for him and put him on the verge of immense power. This is the profile of someone who chases money and influence wherever they lead, even if that may mean the tragic deaths of children and other vulnerable people. Now, Mr. Kennedy is fond of saying he's not making recommendations about whether parents should vaccinate their children. He's just asking questions and giving people choices. It's a slippery tactic to dodge any real responsibility for his words and actions. And it is, in my view, absurd coming from somebody who's trying to win confirmation for a job that is entirely about making recommendations. These recommendations are going to have life or death consequences for the American people. Mr. Kennedy, if you are confirmed, your recommendations determine which vaccines senior citizens get for free.